this is one of the best courses in Europe, and I'm really interested in oncology, and this is a great opportunity for me.
Well, it's well known in Europe, and my supervisor recommended to come here. So they knew about the training, and they said that it's a very good one.
I think it's like a family. I'd say that's not the first time I come here, and each time I find friends and new people, of course, and the atmosphere is really very friendly. It's very difficult to learn by yourself, and it's important to be counseled by more experienced people to fasten your progresses. Otherwise, when you're alone, in some aspect, we have been pioneer myself, so it took me a long time to know what I know today, and when I transmit to the younger ones, I see the course is much more faster to be at the same level. So that's why it's very, very important.
It's important to have a good mentor, and I think when you come in this type of course, you can meet a lot of people that can be your mentor.
As a resident doctor, the most difficult part is, of course, the training, because we are at the beginning and we cannot do very difficult surgeries like the ones that we are practicing here. And I think it's very good that we have the opportunity to simulate like a real condition in the surgery here in the training center.
It's not easy to be a good surgeon. At first you ought to be a good person. If you're a good person, I'm sure that everybody can be a good surgeon.
If you have a good quality surgery, especially in oncology, generally the outcomes in terms of oncology are good. But in terms of tolerance of morbidity, it's not always the same. That's why it's a very important school of modesty. And it's important as well to compare the results, to study the results when you do several patients, to see what the different outcomes, and to adjust what you are doing to personalize your treatment to a specific patient.
But if the question is how we can do a good laparoscopic surgeon in laparoscopy, you have to master three things that we have identified very clearly. One is the anatomy, that you should know the anatomy seen by laparoscopy perfectly, so I mean you should be above the knowledge. And then you should know about how to suture, so to feel very relaxed when you have to do suture, so if whatever happens you can fix the problem. And last but not least, you also have to know how works the energy, because the specifics of laparoscopies, we are working in very small area, very conductive, very close to structure. So if you want to improve the speed of your surgery and improve the safety of the surgery, you have to master also energy. But it is important to have several sessions, because in gynecology we have two types of activity. We have a standard general activity that covers mainly all the benign diseases in gynecology, and then we have kind of subspecialty like urogynecology, oncology, and also some specific disease like endometriosis that we should address.
It's difficult in the same session to address any aspect of gynecology. For oncology is very specific, and probably we could even focus in different localization, tumoral localization, because the subject is very large. And we have to, if you want to have a very good overview of the specialty so you need to restrict to what is really important.
I think that the advantage of laparoscopy is probably that we do better for our patient. The inconvenience is that the surgeon should know more than he knows normally for doing a conventional surgery. So in that case, I think it's very important for surgeons to come and to pick up the tips and tricks that the expert can bring during the course.
Work. So a lot of work and a lot of knowledge, of course, to be up to date.